Hello everyone, I am Kamana Nyopane. For my project 3 presentation, I will be discussing incretin-based medications, also called weight loss medication, especially semaglutide, such as Ozempic or Wegovy, and tirzepatide such as Mounjaro or Zepbound, and their effect on the body. This topic is important because obesity is a major health issue that affects millions of people worldwide. It can lead to serious conditions such as heart disease, diabetes, and high blood pressure. This medication works by affecting hormones in the body that control hunger and blood sugar, which help people feel full for a longer period of time and eat less. Because of this effect, weight loss medication have gained attention not only in medicine but also in public health discussion about obesity treatment. In this presentation, I will first briefly explain three main effects of weight loss medication like semaglutide and tirzepatide. They are significant weight loss, reduced risk of diseases, and possible risks. After that, I will focus mainly on weight loss because it is the most clearly supported effect across my sources. Research consistently shows that this medication leads to noticeable and measurable reduction in body weight, making it the most important effect to analyze in details. This medication has three main effects. First, they lead to significant weight loss by reducing body weight and fat masses. Second, they may reduce the risk of diseases such as diabetes, hypertension, and cardiovascular illness. And third, they can cause some potential side effects associated with pancreatitis and other serious gastrointestinal complications alongside long-term health uncertainties. While all of these are important, weight loss is the most strongly supported by research. Studies shows that individuals using this medication can lose about 14 to 16% of their total body weight just in a year. This shows a significant and measurable result compared to traditional weight loss method. These findings are consistent across multiple studies, which strengthen the reliability of the evidence. Because of this, the weight loss effect is considered clinically meaningful and important for improving health. Even also the medical guidelines suggest that even a 5 to 10% weight loss can significantly improve health. This means these results far exceed the threshold of meaningful clinical benefit. Researchers support this finding using strong data. They use percentages to clearly show how much weight patients lose. They also include large sample size, which make the result more reliable. In addition, they compare medications like semaglutide and tirzepatide to evaluate effectiveness. Real-world studies like STEER and SAFE confirm these findings extend beyond controlled lab settings. All of this evidence shows that the weight loss is not small, it is significantly and clinically meaningful. This is important because obesity can lead to serious health problems such as diabetes, heart disease, and high blood pressure. When patients lose a significant amount of weight, their overall health improves. It can also reduce the risk of long-term diseases, which make this medication very important in healthcare. The study also found that semaglutide and tirzepatide produced a reduction in major cardiovascular events. And also, real-world data showed that treated individuals had up to 57% lower risk of heart attack, stroke, or death. Even though these medications are effective, they can cause side effects. The most common include nausea and digestive issues. These effects vary from person to person, so not everyone experiences them the same way. In the most severe case, medication have been associated with pancreatitis, gastroparesis, and other serious gastrointestinal complications. There are also long-term concerns because many of these drugs are relatively new. Their extent effects are still being evaluated. Research also indicates that patients often gain weight after stopping treatment, which is an important consideration. Here, this graph shows weight loss over time for semaglutide. It demonstrates a steady decrease in body weight, reaching about 14.9% over 68 weeks. This helps visually show how consistent and strong the results are over time. The smooth downward trend indicates that the medication produces reliable, sustained weight loss rather than the temporary fluctuations. In conclusion, incretin-based medications like semaglutide and tirzepatide are highly effective for weight loss. They also provide important health benefits, although they may cause some side effects. Overall, they represent an important advancement in treating obesity and improving health outcomes. Also, the evidence consistently demonstrates that these medications produce significant, measurable, and clinically meaningful weight loss. Thank you for listening.